All right, in this fifth video in our 7-video series, we're going to talk about how these signs that we're tracking and charting clue us into what our health is telling us, what our reproductive system is telling us, and what our vital is cluing us in on how to read this vital sign. So we have just a few that we're going to go over. There are multiple situations, there are multiple circumstances, there are multiple times where you're going to go, what in the world is happening with my chart? Or if you're getting coaching with me, I may look at it and be like, hey, this looks like it could be this. Why don't you talk to a healthcare provider? Because I'm going to say it again, I cannot diagnose anything. I can just say, hey, that is not normal. You might want to talk to a healthcare provider about it. So taking this chart in and what you're tracking and what you're seeing is going to be super helpful. I'm going to also give you some resources to do some more research on your own, to have a resource there. You can look it up and be like, oh my goodness, this is abnormal. What does it mean? Or I don't know if this is abnormal. What does it mean? I'm going to give you those resources in a little bit later video, where we're going to just kind of go through a list of some things that are going to be indicators that something is off. First of all, we're going to go through fluid indicators. When your cervical fluid is off, it could be a signal that something is off with your reproductive health. So if you have continually sticky fluid, this could indicate an infection or cervical issues. When those are ruled out, it's just considered part of your basic infertile pattern. So if you're noticing that you have constantly sticky and you don't really have dry days, you just have sticky days, that may be something you need to have checked out by your healthcare provider. But if that's ruled out that there's no problem, then you can go on and just use those days as days that you're infertile. It's impossible to get pregnant. All right, if you notice that cervical fluid, you're continually wet, it could indicate that you have excessively high levels of estrogen due to, among other conditions, PCOS, which is polycystic ovarian syndrome, or thyroid dysfunction. Another cause could also be an ovarian cyst, which if you had an ovarian cyst, you're more than likely also going to see an anovulatory cycle. You won't see your temperature jump. You won't see that you ovulated that cycle. That's totally normal. It's actually normal for our bodies to get cysts and then just resolve them ourselves. So do not freak out. If you see this happen once and it's odd and it's not normal and you go back to normal, when it happens 3 times in a row, when it happens multiple times in a row, or if you're seeing it as a repeated pattern, that's when you want to see your healthcare provider. So if it's combined with any other abnormal fluid symptoms like swelling or redness or a foul smell, it could be a sign of infection. If you're noticing a lot of fluid with any of those other symptoms or signs, that's when you're going to want to go get checked out for an infection. Okay, patches of wet, we talked about that in the fluid video where we saw a patch of wet, dry, wet, dry, where we're seeing fluid and then we're not, and we're seeing fluid and then we're not. Those could signal stress or a possible ovarian cyst or even PCOS. It is possible. That's something to get checked out with a healthcare provider. To go through that cycle, and if you eventually ovulate in that cycle, then it was most likely stress. If you don't, then it's more likely a cyst, which again, get through the next cycle to see if it's something that's normal for you. And then if it's continuing, you might need to be checked and see if it's PCOS. Talk to a healthcare provider about that. Okay. So then anovulatory cycles, or like we talked about, when your temperature doesn't rise, it doesn't signal that you ovulated, then you're going to want to go check for endometriosis or PCOS, low estrogen or progesterone. That's something that healthcare provider is going to help clue you in. Okay, then thyroid. We talked about thyroid, and then we're going to check our temperature, and it's going to clue us into hypothyroidism, which causes sometimes anovulation, long or irregular cycles. You're going to see prolonged or less fertile quality cervical fluid. You're going to see short luteal phases. So that phase after ovulation, before your next period, is going to be shorter than ideal, shorter than acceptable even. Your temperatures are going to clue you in as to whether or not this is going on. It's one clue. Ideally, you're going to want to get your blood tested for your TSH levels, your thyroid hormone levels. You're going to want to talk to a healthcare provider about this. But one clue, and this is what I noticed, when my thyroid level was off, my numbers were super low. So that's called hypothyroidism. And anything that's a regular temperature for you pre-ovulation is 97.3 or below. That's going to signal that your thyroid is underactive. It's not producing as much heat, and so your temperatures are low. Pre-ovulation, so those low temperatures when we were looking at the forest, the ones below the cover line that we drew. However, if you have hyperthyroidism, it's when your thyroid is overactive, it's working too much, it raises your temperatures. You're going to see those pre-ovulatory temperatures of 98.4 and above. So you're going to see really high temperatures. You're also, if you have a thyroid issue, more likely to see heavy, prolonged, or painful periods. And then you're going to see severe PMS. Now, PMS symptoms when they are severe, or period symptoms when they are severe, these are not normal. And I totally did not know that when I was a teenager, and I wish that I had. I wish that somebody had said, yeah, the fact that you have to go home from work while you're on your period because you're on your period is not normal. Please see a healthcare provider about that. I'm going to give you some resources in a later video. We're going to talk about books that are going to provide a lot of insight into that. Do some research, see if what your experience is normal or not normal, and do your research, figure out what your body's telling you. Okay, so we talked about with hypothyroidism, you're going to see a short luteal phase. Another reason for a short luteal phase is a problem with low estrogen. Do you remember how we said that estrogen peaks after ovulation and it stays high? And if you get pregnant, it stays high. And then if you don't get pregnant, it drops. And that signals, when you're going to get your period and your next cycle is going to start. If you have low progesterone, it's not going to be able to sustain that ideal luteal phase length, and it's going to drop sooner. Now, this is a problem when you're trying to get pregnant because you need to have so many days so that the baby can implant. And if you don't have enough progesterone, it can't support implantation. And you're actually going to experience what is referred to in the medical community as a chemical miscarriage. It means that you miscarried before a pregnancy test would have even been positive. There's no way to know if this has happened, so do not stress out about it. But just know that low progesterone could cause infertility issues, and that may be what's going on with that short luteal phase. That is something to talk to a healthcare provider about. Okay, endometriosis is another health issue that you're going to see. It's going to have a pattern, a repeated pattern. And that's something, work with a coach, work with a healthcare provider to get clued in as to whether or not endometriosis is what you're dealing with. So another thing that could throw off your normal or clue you into something that's kind of throwing things off is excessive prolactin, which is the hormone that you have when you're breastfeeding. If you have it when you're not breastfeeding, it's a problem. You need to talk to your healthcare provider. So it's fairly easy to treat in non-breastfeeding women, but it is going to kind of throw off your cervical fluid pattern. It's going to throw off your temperatures a little bit. Just know when you're breastfeeding, cycle tracking is a little bit more difficult. It's going to throw it off. It's going to make it a little bit more abnormal. You may not see your cycles return. You're still going to want to chart, because remember, what happens is ovulation, which signals, the rise in progesterone, and then when it drops, you have a period. So you are going to actually ovulate before you have a period after you've given birth. So when you're in the postpartum phase and you think, oh, well, I can't have a baby and I can't get pregnant again until I've had another period and I've gotten my cycle back. Not true. We're going to talk about this more in the birth control video. But the fact is that you're going to ovulate first and then you're going to have your period. I know that's a little bit confusing because on the whole cycle graphic, it shows that the period is what starts first. That's just what we consider to be cycle day 1. But your ovulation is what happens first. And it's what signals this whole thing and sets it off. Okay, so these are just some of the things that could be a clue as to something not being right with your reproductive health. There are other things, there are other signs, other symptoms. Like I said, I'm going to give you resources. If something's off, it is so important to talk to your healthcare provider. A coach is going to be someone who can help clue you into like, this is not normal. And you're going to figure that out as you keep tracking what's normal for your body, what's abnormal.